Welcome to All Things Cardio-Oncology. This is the official podcast of the International Cardio-Oncology Society. My name is Steve Caselli. I'm the Executive Director, and it's great to have with us today the President of the International Cardio-Oncology Society, Dr. Daniel Lenihan. He is also the Director of the Cardio-Oncology Center of Excellence at Washington University in St. Louis. One of the exciting developments for the cardio-oncology community is the creation of a certification exam. And Dr. Lenihan has really been leading the efforts to create this exam, so we wanted to hear more about that from him today. So welcome, Dan.
Thank you, Steve. I really appreciate it. And I definitely appreciate all your efforts in terms of helping us to organize the International Cardio-Oncology Society. And I think that this test is a great reflection of the overall improved organization that we have. So thank you very much for that.
Oh yeah, well, it's a great effort, and it's a real privilege for me to be a part of it. Maybe you can start just by telling us sort of why and how this exam came about, what your thinking was behind it.
Yeah, so many of us, probably collectively 15 or 20 of the leaders in the cardio-oncology field had been discussing, how do we demonstrate our, evidence of our knowledge, number one, but also how do we make sure that, various practitioners out there have a good basic fund of knowledge that is relevant to cardio-oncology. And so as we were discussing that, it became obvious that the only way to really, demonstrate that knowledge would be to either have a fellowship, if they could participate in that, or also to have a good understanding of a curriculum, an active curriculum for cardio-oncology, and then lastly, to be involved in the development of research that we all learn from each other. But a tangible way to demonstrate that a certain amount of knowledge is to take a test, basically. So we decided that it would be important for us to develop a test so that people could validate their fund of knowledge. And so that's in essence how it came about. And collectively, there were 15 to 20 cardio-oncology experts around the world that participated in up to weekly webinars and teleconferences to develop questions over the past year. And so that's how it came about.
That's excellent.
Yeah, and that's basically who created this exam are people that should be knowledgeable in the field. And, they were trying to make sure that the test was reflective of ongoing knowledge in the field, but also was fair and represented, continuing education that different practitioners may have undertaken to be knowledgeable in the field.
Yeah, I think one of the amazing things about the International Cardio-Oncology Society is that it's international, and so you've got experts working literally globally in cardio-oncology and then coming together for things like this exam. So I think that really enhances the value of something like this.
Yeah, we certainly had international representation on the exam development, and we obviously will continue that in the future for sure. That's a major priority for us.
And help us understand why you see this as being important really for the advance and growth of the field in general.
Well, I think that if we take some other examples in clinical practice that, not that we want to do anything exactly like other groups have done, but certainly you can learn from other groups. And I think that's what we were trying to do. But if we look at some examples of practice areas, some are larger than others, but certainly let's take some examples. So advanced heart failure and transplantation is ABIM, or American Board of Internal Medicine, certified at this point, and the programs are accredited. But, when I did my fellowship training back in the early 1990s, there was no advanced heart failure fellowship. And it took over 20 years to really develop the structure for that fellowship. And then in 2012 was the first time that any program could become accredited. And that was also the first time that there was an ABIM type test for advanced heart failure. So this is a large group of cardiology practitioners who are focused on advanced heart failure and transplantation. And so that represents kind of the biggest group out there, that recently developed a board type test and also accreditation for their fellowship. Let's take some other examples of smaller entities where they developed a test to make sure that you understood that knowledge and then you could use that in your practice. Other examples include advanced echocardiographic imaging. They have a board test. There's no fellowship. Vascular interpretation does not have a fellowship, but does have a certification exam. And then cardiac MRI has a board review course and a board test. They do not have any kind of fellowship that's dedicated at this point, but now there is some development to try to incorporate imaging into one focused fellowship, but still that's a work in progress. So just looking at other examples, you would say there are a lot of different ways that people, interested groups go about having a basic test. And for cardio-oncology, we felt that it was critical that it be international in scope and that there is a certain amount of knowledge that we expect, our colleagues to know. And it's not all just in cardiology, it's certainly in the oncology space. So it is a broad set of topics.
That's a good lead into one of the questions that I've been asked on more than one occasion and that's, who should take this exam? Is it limited to, some people think it's limited to cardiology or limited to oncology, but I hear you saying it's much broader than that. It's truly a cardio-oncology exam. So who else should consider taking this exam?
Yes, I mean, this is a great question. And I think we had sort of briefly talked, is this ABIM or American Board of Internal Medicine approved? And the answer to that is no. But I would also say advanced heart failure wasn't ABIM approved for over 20 years. So I think that, I don't know if we're ever going to, get that kind of level of approval, et cetera, that would come with being ABIM certified. I don't know if that'll ever happen, but if it does happen, it's going to take a long time. So this particular test is not ABIM approved. This is ICOS, or International Cardio-Oncology Society, approved. And then is there a precedent? Yes, I gave you examples of other areas, and I think that there are a number of precedents that we can bring up, but we chose to proceed with an international based test that has a broad representation of cardiology and oncology and other disciplines. And so then the question, who should take this exam? Well, we would say anybody who has an interest in cardio-oncology in their practice. So that could include, of course, cardiologists. It could include oncologists that have an interest in understanding about cardiovascular toxicity. It could be nurses, PharmDs, other advanced practice nurses, nurse practitioners, physician's assistants,
Hmm.
Exercise physiologists, whoever has an interest in cardio-oncology understanding, and their patients are in essence patients that have cardio-oncology problems. That is who could be interested in taking this exam. And what it does is really solidifies, their learning. So in the
Yeah,
sense that if they understand these complex topics and they are able to pass this certification exam, then they have a certain level of expertise that should be recognized.
that's excellent. And then just very practically, when will the exam first be offered?
Our first official exam will be offered during the time of the ACC meeting in March of this year. We will probably have a second offering of the test in and around the Global Cardio-Oncology Summit in Toronto in October, beginning of October.
Hmm.
So at this point in time, we'll probably have two administrations of the tests, one this March at ACC, and the second would be around the Global Cardio-Oncology Summit in Toronto.
And
It
I
can't,
believe that's March 28th would be the actual day of the exam. Is that right?
let me see, yeah, it was going to be on
I
a
think so.
Saturday. Yep, Saturday, March 28th, 2020.
And so for those who aren't able to attend that conference, could they do it at the same time online?
Yeah, so we have the test is administered online. For those people who attend ACC, we will and do want to take the test, we can have a paper version printed and they can take it, in a testing area or an online test. The the what we will give people 24 hours to complete the test, and they can do it on their own time, uh, and that way, as long as they have adequate website access, then they
Yeah,
should be able to take the test without difficulty.
that's great. And just a reminder to anybody who's listening, you can go to the ICOS website, ic-os.org, and under the resources section, or the research and education section, there's a link to the board application for the exam. And then a number of people have also asked, obviously, about preparation and review for the exam. What's the course there that you're considering for preparation and review?
Well, we've been trying to establish how to do this best. We do think that a board review course would be ideal. I also think that we're pondering or contemplating whether to have a board review course for, a day or maybe a day and a half, and then follow that up with an administration of the test at the end of that review. That is one proposal. We're still in the planning phase for that. And I do think that as part of the planning phase for a board review and test administration, that we will develop review material. So we already have that in development, but right now it's not currently published or available. But we hope to have some important update on that in the very near future.
That's great. And I know there is a reading list, and we're working on a list of topics that we can get out to anyone who's interested in taking
Yeah,
that
we'll
test.
certainly, hopefully within the next week, we should be able to post all those things on the ICOS website.
Great. Is there anything else you would want anyone to know as they consider taking this exam?
Yeah, just that we really want people to take the exam because we want them to, number one, understand, what the scope of the field is at this point. And I think by taking the exam, you'll understand that, because pretty much all of the field that we're encountering will be reflected in the test. So by taking the test, you're really, depending on what your practice location has been and what your exposures are, you may not have seen sort of the whole breadth of everything that we are hoping to include in general training. So I think taking the test is going to be educational for sure. And then the other piece is that by taking the test, we will learn, what people know. And I
Yeah.
think that will help focus our educational efforts. So if there are some area of what we think cardio-oncology knowledge should be, and we ask those questions and nobody really seems to understand those questions, then several things could be taken from that. Either, we haven't educated people well enough about those topics, or maybe we're not seeing what's actually happening out there. So this test, although this is the first one, it is absolutely a work in progress. And,
Yeah.
we're going to learn a lot from the people that take the test. We'll learn what we need to know better. So I think that really by taking the test, I feel like you're contributing to the field. And I think that is, of anyone who's considering taking the test, I would say, please don't forget that fact. We really are learning from each other. And by taking the test, you are helping us, really not only educate ourselves and perhaps the individual taking the test, but it also tells us what the field needs to know.
That's a great point. I think that's, again, one of the great things about this field growing and developing is it is a work in progress, and we're truly learning from each other in the community. So that's an excellent reminder. And just a reminder again, you can go to ic-os.org and look at the Research and Education tab, and there's a link for the board certification application. Dan, thanks so much for your time today, and we'll definitely look forward to talking further as this as the exam develops and getting a report on how it goes.
Perfect. Thank you so much. Appreciate it. And for any listeners out there, we want to be engaged with you, and we want to continue to learn from each other.
Excellent. Thank you so much.
Thank you.